We'll start in just a moment.
Whenever you're ready, Senator Pinsky, you're live.
Okay, we'll wait just one more moment.
Chairman.
Welcome to the Education, Health, and Environmental Affairs Committee briefing on education, on reopening and learning loss. We are on a bit of a tight schedule today because a number of our guests have other requirements and responsibilities. So our plan is to go from 1:15 to 2:45. We have asked a couple of questions specifically for the local superintendents to speak to, and also the teacher representatives. So the agenda today is we're going to start with Dr. Simon, the State Superintendent of Schools for Maryland. We'll give her time to speak and then have a limited amount of time for questions. They'll be followed by the 4 local superintendents, Dr. Santelises from Baltimore, Dr. Golson from Prince George's County, Dr. Griffith from Talbot, and Dr. Bolson from Hartford. And we'll follow that also with an extensive time for questions. We'll wait, if possible, till they're all done before we ask those questions. And finally, we'll also hear from Owusu Achua PK from MSEA and Diamante Brown from BTU, and also allow questions for that. I think we're all, it's a very important day, whatever party you're from, to have inauguration. So we do have a new president. So I, for one, am pleased to celebrate that today, but we could hold off ideological conversations for another time. With that, and getting started, we're very pleased to introduce and have join us Dr. Karen Salmon. Dr. Salmon.
Thank you, Senator Pinsky, and good afternoon to everyone, Vice Chair Kagan and members of the committee. It's really nice to see your faces. I never thought I'd say I'd like to be sitting at the State House today, but I actually would like to be with you in a room. I think it would be great, and hopefully we'll get to that at some point in time. I also appreciate the opportunity to share with all of our stakeholders today and to give you an update on our efforts to push for the safe return of students to school buildings for in-person learning. I was wondering if you could show my slides, and I think we're ready to start with that presentation.
Give me 1 second, I'm pulling these.
Thank you.
Yeah. Oh, I had them up.
I'm going to go ahead and speak, and hopefully we can get caught up when the slides come up. I know time is as you all know, since the early summer, I've been a very strong advocate for getting our children back into the classroom. The impacts from almost a full year of students not being in the classroom has been very significant. And the longer we keep students in a fully virtual environment, the greater those impacts will be. I think that's the wrong presentation, actually. This is from the State Department of Education.
Okay. Give me 1 second.
We know that there's a direct correlation between this time of uncertainty in the virtual learning environment and those debilitating impacts from this extended period of disrupted instruction that students are experiencing. We've been working in consort with the State Board of Education on a COVID dashboard, which will house a number of the performance metrics from the very first term of the school year, that will also give us a broader sense of what learning has looked like and where some of the greatest areas of need may be that will be addressed in the immediate future. However, we already have a window on some of the impacts of virtual learning. For example, in Montgomery County, we saw failure rates in excess of 5 to 6 times what is typical grade-wise compared to this time last year. And unfortunately, it's being seen disproportionately among low-income students and students of color. Modeling from McKinsey and Company illustrates that the cumulative learning loss by the end of the 2021 school year could equate to 5 to 9 months on the average, with the losses significantly greater for those that were previously academic disadvantaged. While we currently cannot quantify on a comprehensive scale the total impact on not having students in school for in-person learning, my qualitative understanding of it grows every day as I hear from families, parents, and students alike, desperate for a return to school. If we're on the second slide, please. Our students need all of us in positions of leadership at the federal, state, and local level to act quickly and decisively to prioritize their immediate return to school. While we must, of course, take every precaution to ensure that they are coming back to safe buildings, the greatest mitigation strategy to limit further learning loss stemming from disrupted instruction that we have at our disposal is to work together to get our students back in the classroom. Next slide, please. While we've unfortunately experienced a surge across the nation and in Maryland in the number of cases of COVID, schools have consistently demonstrated in data from across the globe to not be identified as the source of super spreader events related to the virus. The student infection rate is significantly less than the community rate. A number of state and local school systems across the nation have returned their students to school buildings. According to a public school COVID dashboard analyzing a number of learning models nationwide, at least 86% of systems were providing at least some in-person instruction as of mid-December. While several school systems safely and successfully provided in-person instruction for small groups of students over the course of the summer and into the fall, there are currently few in our state providing any degree of learning physically in our schools. This morning, there are 10 school systems that are providing instruction in very small groups of students, and one system that is providing all hybrid instruction to all students, and that is Carroll County. With that in mind, our focus has been on exacting every measure necessary to reinstate an educational landscape in Maryland that provides in-person opportunities for students. Next slide, please. Late in December, I formally submitted a request to the Maryland Department of Health that teachers and school staff receive priority in the distribution of the vaccine for COVID-19. The governor announced earlier this month that these individuals would be included in phase 1B of the distribution plan for the vaccine, with phase 1B commencing this past Monday. Since that announcement, I have been working closely with the team at the Maryland Department of Health to develop and have ready for implementation a plan to identify and efficiently vaccine educators and school staff in both private and non-public schools and also child care providers. All local school systems are coordinating with local health departments and local hospitals to identify available vaccines to administer to their staff. Several systems across the state have already been vaccinating school staff at this time, and more will commence vaccinations in the coming days. Next slide, please. This past summer, MSDE and the Maryland Department of Health issued the first iteration of the COVID-19 guidance for the education community. This detailed health and safety considerations and recommendations for local school systems as they contemplated which mode of instruction they would operate within the coming school year. We also provided metrics as a guiding post for local school systems and health departments to use as a barometer for how the community spread of COVID-19 could affect the operational status of schools. Those metrics were not designed to be fully restrictive or prescriptive, but the vast majority of systems have utilized the metrics to tread cautiously, regardless of the metrics, and to maintain virtual learning. I've been working closely with the Maryland Department of Health to accurately reflect current research available in the field on community spread and transmission rates. MSD also released a recovery plan for education built with input from stakeholders and local school superintendents that detailed potential hybrid learning models and provided recommendations for maintaining the continuity of learning and instruction, regardless of whether students were learning virtually or in a hybrid fashion during the pandemic. This plan also required each school system to develop their own local recovery plans and to provide information on how they plan to reopen schools. MSD has and will continue to offer technical assistance to any school system that begins the process of reopening in their jurisdiction. Additionally, there's been a significant influx of funding to address critical areas of need as school systems tackle the endeavor of operating under COVID-19 restrictions and confront various challenges. Next slide, please. The CARES Act, which was signed into law March 17th, provided a significant amount of funding opportunities to our local school systems. Various grant programs included the Elementary and Secondary School Emergency Relief Fund, which provided $187 million directly to school systems for a broad range of activities. The Governor's Emergency Education Relief Fund, totaling $35 million to support local school systems, was used to support the development of a wireless education network, technology needs, and innovative solutions for connecting at-risk students. Relief funds, which comprised $210 million, included $100 million for technology advancement and $100 million for tutoring, with an additional $10 million for enhancing broadband access. Recently, in the last week of December, the Coronavirus Response and Relief Supplemental Appropriations Act was signed into law and provides over $780 million to our local school systems for a wide range of allowable uses, including remediation of learning loss, implementation of summer learning programs, and purchasing educational technology. Additionally, the Maryland State Department of Education offered and provided available funding totaling $10 million to support local school systems separately in their reopening efforts. Next slide, please. As a part of the fiscal year 2022 governor's budget allowance, over $150 million is included for tutoring and supplemental instruction. Additional funding for evidence-based strategies such as extending and implementing high-intensity tutoring services to more students, establishing additional and extended summer learning programs, addressing social-emotional learning, and provided targeted academic acceleration to further mitigate the impacts from this disruption of instruction are all vital strategies in our efforts to combat the impacts of the coronavirus on our students. I strongly encourage our local school systems to consider many of these as they develop their plans for the utilization of funds, particularly targeted tutoring and extending the length of the school year for summer learning. During these unprecedented times, we are grateful for the funding provided to our local school systems to support their reopening efforts and address areas of concern stemming from the period of disrupted instruction. MSD remains incredibly focused on distributing these funds to local school systems to bolster programs that seek to limit learning loss, accelerate learning, and get our students back into school. MSD is also planning to vigorously monitor the expense of these funds to ensure that they are being used to implement the strategies that I've highlighted today. Next slide, please. As the state continues to move forward and work on plans for vaccinating educators, school staff, and childcare workers, we look forward to working with any and all stakeholders to actualize the goals outlined in the various funding programs. And we must all treat these issues with a sense of urgency. MSD and the state board will continue to consider strategies that can be considered on a statewide level to lift all school systems in Maryland. And that discussion will continue at next Monday's state board meeting, where we will review the data dashboard and the metrics from the first term of the school year, and plans will then be presented to the state board for the remediation of disrupted instruction. I will be happy to provide copies of that presentation to you once it is available this Friday. Thank you again for the opportunity to present today, and I'd be happy to answer any questions from the committee at this time.
Thank you very much, Madam Secretary. Let me start off with two, and we've got 10 minutes. We want to keep this fairly close and accurate to stay on time. how much money is available for the tutoring and summer school for the next 12 months?
Well, the school systems, in terms of what's in the governor's budget, that is 150 million. But the school systems all can use their CARES funding too, or ESSER's funding too, as we describe it. And, that varies based on the school system size and Title I funding. But we go from as much as 200 million to school system to somewhere around 4 million for some of the smaller school systems. So they'll have what I consider to be an ample amount of funding to use for tutoring and extended summer school programming.
So that 150 million is available as of July 1?
Yes, sir.
Okay. And my second question is, I believe in the metrics that you and the health department set up 5 or 6 months ago was 5% was the threshold. If positivity was over 5%, school systems should be wary of moving forward with in-person instruction. I haven't seen it in the last 3 or 4 days, but last week it was 8.3. Does the State Department of Education still stand by that marker in terms of positivity of test rate?
What we found, and again, I'm not a doctor for the medicine part of things, but what we have found through looking at the research is the positivity rate is really not the best predictor because it depends on how many people are being tested and who is being tested. So as we look forward, we're going to be looking at how to look at these metrics in a different fashion. And as I said, information about that will be forthcoming in a very short amount of time.
Okay, and I'm going to Senator Washington next. If it's a community positivity rate, and even though schools might not transmit it, if a child gets it from their community and brings it into school and interacts with other children, can they take it back out to the community? So I'm trying to figure out what the other better metrics are to decide and give direction to the local superintendents.
Yes, we're gonna roll that out very soon. And again, I think it makes a lot of sense with all the current research we've been reviewing, because Senator, we didn't know a lot in the very beginning of this, but we know a lot more now as we've been studying things across both the United States and also globally.
Great.
So,
Okay, let's go to that. I don't mean to cut you off. Senator Washington, followed by Senator Lamb, followed by Senator Ellis.
Thank you. Again, thank you, Dr. Salmon, and thank you for everything that you're doing. I know this is challenging. This is just a sort of a follow-up on our questions that we asked you, during our last briefing, where we were trying to get some clarity on closing when there are outbreaks and some definitions. And we asked you to look at standardizing some of these definitions, and you said you'd go back and have some conversations with state with the board and some others. Have you had an opportunity to do that?
Well, actually, that was done by the health department. They have posted that information on their website as far as any outbreaks that have been in school. In terms of school outbreaks, that is defined as 2 or more cases within the same area. So for example, it would have to be in the same classroom, or would have to be, it couldn't be that an outbreak was considered if a bus driver tested positive and a student that wasn't on their bus. So that's the metrics that currently the health department is using as far as the outbreaks. School
has the state provided procedures? This was something that we asked, that you provide specific procedures for each of the jurisdictions to follow. And again, we find standardization across school systems is really important.
Right.
And yes. So have you had an opportunity to do that?
Yeah, certainly that has been done, and it's in our guidance. And certainly since most of the school systems have been closed, I think it's fair to say that they are following what their local health departments have advised.
And then Chairman, just to follow up around the
more quick one.
Vaccinations. Are you working on, or in collaboration with, how to get vaccinations to teachers and workers in our schools as we're moving towards opening?
Yes, we have several counties that have also been working with me on this. And all the superintendents have submitted to me the numbers of staff that want to have vaccines. All of that numbers have been sent to the Maryland Health Department. So they're kind of figuring out the number that they need. And local health departments and hospitals are partnering with the school systems to be the vaccinators. Caroline County, for example, has almost completed 100% of their school-based staff. Talbot County has done about 50%, and we have reports from across the state that we are far along with giving out these vaccines. So we're very excited about that.
Thank you. Thank you, Chairman.
Thank you, Senator Dr. Lamb.
Sure. Thanks, Mr. Chairman. And I wanted to follow up on the chairman's question. I think the metrics here are really important. So, you know, I'm hearing mixed messages and different stories, and that's why I just want to clarify this, because this is really, really important for our schools and for the safety of our kids. So on one hand, we hear and we've heard over the last 10 months from the governor, the positivity rate, positivity rate, positivity rate. And we've used the metric of positivity rate of 5%. And now what I'm hearing from you is that, and this is what I've contended for a while, is that positivity rate is only one metric. It's only one measure. And now you're agreeing with that contention that positivity rate shouldn't be viewed in solo. It should be viewed as part of one metric, which is very different than the message that we've been hearing in press conferences for the last 6, 7, 8 months. And now you're saying in response to the chairman's question that you don't know what the other metrics are, that you're still trying to figure that out, even though it's 10 months into this pandemic right now. You're still not sure what those other metrics are that should be weighed to determine whether schools should be open. It seems like there are a lot of moving goalposts here. There's a level of, you know, confusion and maybe intentional obfuscation that's going on. And this is really concerning to me because this is really about the safety of our kids. And so can you clarify that? Is that true that now you're looking at other metrics, which I think is a good thing, but you don't actually know what those metrics are?
Well, Senator, I really appreciate your question, but I don't appreciate you putting words in my mouth. So let me just to go back to that. I didn't say the things that you just said. So what I said is positivity rate was one of the metrics we looked at early on, because that's exactly what we were looking at across the nation for trying to come up with some kind of metrics. There's no science around the metrics. There's no research studies to support metrics. So what we have to do is to look at what is the impact of applying these metrics on what happens with being able to open or close things. So all I'm saying is we will be releasing new metrics very shortly. I do know what they are, but at this point, I can't share them until they've been fully vetted with the health department.
Okay, I would urge urgency and to do so quickly, because I think, you know, the local school systems have been waiting for a lot of guidance, and it's not just this issue that they, at least from my understanding, have not received much guidance. And so this issue is really important. Having those numbers and the metrics are really important. And, you know, if it's not positivity, which seems like it's a changing tune now, then we need to know what those other metrics are.
Isn't that so? Thank you, Senator Lamb. We're going to go to the final question for Senator Ellis, and then we'll move on to the 4 local superintendents, and we'll actually have more time for questions then. We're just, as I said, under a tight time constraint. Senator Ellis.
Thank you, Chairman Pinsky. Thank you, Dr. Simon, for being here. And in your presentation, you mentioned that you're looking at, you know, how these students who miss so much can get caught up remediation, basically 9 months, 6 to 9 months of education. So being a former Air Force officer, we've done a lot of contingency planning. And so I know you're working on this, but it's a multi-part question. So the vaccines are here. Okay, that's a fact. School personnel are being vaccinated. Okay, imagine stepping forward, say into May, you know, it's safe to reopen schools. But hey, we're here into June, the summer vacation season. Are there plans in place to consider having these children learn throughout the summer? Or say if the state of emergency is over, would you need legislation to allow a school system to operate in the summer to allow a lot of these students to catch up with the learning they've missed over the past almost a year now?
Well, Senator, that's a really good question. I don't think we need legislation. I think all of our local school systems, and we chat with each other every week, the superintendents and myself are all planning to do summer programming in a very rigorous fashion this summer. And I think it's certainly what we know, extra time does make a difference. And we have a lot of time to make up for, because even though we were providing virtual instruction, it has not met the needs of all children. So your suggestion, are we ready to do this? Do we have our contingency plan set? Yes, we are all working towards looking at what we need to do as soon as we get everyone back into school, and then how much longer we can work with them over the summer. I think everybody is focused on that right now.
Okay. So would you, it would be a targeted summer school program for a small, narrow amount of students, or would it be like everyone back to school?
I think we're going to work with each local school system to support whatever they feel that they can provide, but I think there are enough funds for us to do a very, very rigorous program for this summer.
Great, thank you.
Thank you, Dr. Salmon. I know you have a state board meeting coming up and you want to wait till you brief them. We appreciate you coming on today. There may be other questions and they will be done offline, but thank you. And just please keep us abreast as more decisions are made by you and the State Board of Education.
Thank you very much, Senator. And I'm able to stay on the whole time. So if there are additional questions, I'll be
that's
happy
great.
to answer them at the end.
Very much appreciated. Okay, now we're going to go to 4 local superintendents who have to actually implement every day the program for these students. And all 4 superintendents were asked to address 2 questions. One, reopening, and they're not all doing it the same way. And obviously there are other conditions and of the pandemic that make that a floating and changing target. And the second question we asked them was, what strategies would they recommend to us in terms of addressing learning loss in a more immediate sense? We've heard about tutoring. We've heard about summer school. There are probably others. I was just trying to do the calculation of how far $150 million would go to the 24 jurisdictions, and I haven't come up with that number yet. But they can also include in their comments whether they think that money in the $150 million comes close to what they're going to need over the next 12 months. With that, and I know she has also a time constraint, the CEO of the Baltimore City Schools, Dr. Santelises, thank you for joining us.
No, thank you, Chairman Pinsky. Want to say good afternoon also to Madam Vice Chair Kagan and members of the committee, including our own Senator Washington from Baltimore City. Hello, Senator. On behalf of my superintendent colleagues from across the state, we really do appreciate you bringing us together for this important discussion. And I will, Chairman Pinsky, address the 2 questions that you just outlined. So first, with regards to in-person instruction, since September, City Schools has continually expanded our optional in-person learning opportunities for prioritized groups of students across our district. We know there are groups of young people who desperately need the support they can only receive in person. We also know that growing numbers of our families want this option, and we've proven since the summer that we can do it safely. We announced last week that for second semester, City Schools will expand optional learning to traditional and transformation school students in kindergarten through 5th grade, as well as 9th grade students and high school seniors to begin. The program will open to all traditional K through 5 students who attend an elementary, middle school, or all 9th and 12th grade students who attend traditional and transformation high schools. We also have numbers of our charter schools who will have the option of coming alongside our 3 phases, which basically begin Tuesday, February 16th with kindergarten through grade 2. Grades 3 through 5 begin Monday, March 1st, and grades 9 and 12 begin Monday, March 1st. We believe many of our families will choose to remain with virtual learning option, and many of our classrooms will have small groups initially. But what we have shown, what we have learned is that as we earn trust and confidence, there will likely be more families that choose the in-person option, as we have seen since the summer. We've taken a cautious, phased-in approach based on our health experts' advice, and more than 2,000 students have benefited with instruction that fits their needs. Since in-person learning opened on September 28th, our contact tracing shows there have been no transmission cases at our in-person learning sites and 1 case of in-school transmission at a meal site. Through a collaboration with Baltimore City Public Schools, Johns Hopkins Medicine will begin COVID-19 vaccinations this week of nearly 500 teachers and school staff already working at in-person learning sites. Vaccinations for additional groups of 500 employees each week minimally are planned for future weeks. Under a plan developed in concert with Baltimore City Health Department, prioritized employees working at in-person learning sites will indicate their interest in receiving the vaccine, and up to 500 of those prioritized employees will be randomly selected to be vaccinated starting Tuesday, January 19th, that was yesterday, and employee vaccinations are not mandatory. I will let you know that as of yesterday, we had 713 prioritized staff members already signed up for vaccinations. The first wave of vaccinations will prioritize staff who have already been working in person, including meal service workers, teachers, custodians, and administrative personnel. And then following this week, Johns Hopkins Medicine and city schools will continue providing additional vaccination in subsequent weeks to employees working through our prioritized lists. This critical collaboration builds on city schools' comprehensive plans to safely host additional in-person learning opportunities while combating the spread of COVID-19 in Baltimore City. These efforts include daily on-site testing for staff and students who show symptoms and implementation of CDC's 5 mitigation strategies and additional strategies for schools. With regards to mitigation of student learning loss, including how many students need services and how that's being determined in terms of standard assessments to mitigate student learning loss, we have been and will continue to review academic data from our Amplify data, which is really foundational literacy skills, our iReady data in literacy math, along with a review of attendance and grade failure data, some of which we rolled out most recently in our public board meeting. The combination of these specifics will provide a profile of student needs. We have prioritized tutoring and small group instruction to support students with recovering skills. The summer, as you noted, and as Dr. Salmon noted, will be an important time when we can provide additional learning opportunities. And then moreover, we are planning for this mitigation to continue into school year 21, 22, and subsequent years, where our goal really is to provide additional and different learning experiences that we have gained and developed during this time. More than happy to take questions after my colleagues go. Just a sampling of data before I turn it over. We found that in grades 3 through 8, 78% of our students who are chronically absent have a core course indicator of a failing at least one class. In grades 9 through 10, 86% of students who are chronically absent have a core course indicator, and 60% have at least one failing grade. So as we move through to additional mitigation strategies, as well as summer learning, and I would say extended year learning opportunities and extended day opportunities, we are going to see the need for ongoing support of which, as Dr. Salmon mentioned, the CARES Act really is an initial boost to those efforts. And with that, I
Thank
think
you.
I'm within my 5 minutes, and we'll turn it over back to you,
Well,
Chair.
a little inflation on your timing, but it's totally.
Oh, sorry. I thought I started at 1:45, but my apologies.
Please, we appreciate your time and your words. Dr. Santalisa, you mentioned you'd stay to take questions after your colleagues. I know you were on a very tight time schedule. Has that
I
loosened
am.
up?
My chief of staff is going to begin with the next group of legislators, so I will stay here,
Okay.
Chairman, as long as I can. Thank you.
Thank you very, very much. Dr. Golson, CEO, Prince George's County, please.
Thank you. Good afternoon, Chair Pinsky, Madam Chair Kagan, and to my own Senator Patterson. Thank you all for having me today. So for Prince George's County Public Schools, we announced on the first day of school that we will be doing virtual learning until the beginning of second semester, which was to begin on February 1st. In December, as we started to notice that our COVID-19 numbers were continuing to increase, I made an announcement that we would continue with virtual learning until further notice. A letter will go out today to our community, alerting them that I will reassess this situation mid-February in light of where we are in terms of vaccinations and the fact that our COVID-19 numbers have started to decline as of this past Friday. They have been rising since Thanksgiving, and every day since Friday, they have now decreased. For Prince George's County, just so you know, for the 3 factors that we look at from the CDC and the Maryland Health Department, the percent of positive cases right now are at 11%. The number of new cases per day are at 468, and the average daily case rate is at 51%. So we are well out of the metrics that we utilize. But good news, not only have the numbers started to decline as of this past Friday, but we will be working with Kaiser Permanente to begin the vaccination of our employees. We did a survey and approximately 9,000 of my employees want the vaccination. We expect to begin that on February 1. We will be able to administer 400 vaccinations per day at 3 sites. We will be selecting 3 schools in northern, central, and southern part of the county. So that will yield approximately 1,200 vaccinations per day beginning February 1. Tentatively February 1. We will be prioritizing first starting with our food service workers, our building services staff, and our bus drivers who are our frontline workers who are working every day to disseminate meals and clean our buildings behind COVID-19 positive cases. I believe that because of the vaccinations and the continual decrease, that we will be able to do in-person learning starting in the spring in small groups, meaning looking at pre-K through grade 5 and special education students. Once again, looking at those rates and our number of employees that will be vaccinated. In addition, in terms of mitigating the student learning loss and what we've done in compliance with the state mandated bridging diagnostic assessment program, as well as the administration of our district's fall benchmark assessment, we had approximately 404,150 tests that were successfully administered online through our Pearson Access platform from December 11th through September 11th through December 11th. And in addition, we had 65,000 assessments in reading, English, language arts. From that data, what we are able to ascertain is that we do have a gap that we have to fill in the terms of mathematics. What we see is a decline in our mathematics student assessment data. In reading, English, language arts, we don't see a major decline in that area. And that's probably because of a lot of additional support that we're receiving through some of our online supports, mainly a program called Book Nook that we're offering to approximately 3,000 students in tutoring after school, where we found an average of 2 months of reading skills, biggest gain at the grades of 1st and 2nd grade. And that's because we do have 84% attendance in that program. We too, just like Baltimore City, plan to do in-person summer school program. We will be looking at a targeted group, special education, and our English language learners. And just so everyone knows, we have approximately 14,000 special education students and 27,000 English language learners. So we want to be able to offer that support this summer. We are looking at the use of our CARES Act funds to provide an extended school year for the 2021-2022 school year, as well as an extended school day. The focus in that extended school day will be in a non-traditional approach. One, to provide additional social emotional support that we know our students will need as they re-enter the school building, as well as looking at what has worked is flexible tutoring support virtually. We are now a one-to-one district. We don't plan to take the laptops back from our students when we return to brick and mortar, but we will use those laptops to help leverage that additional support to families in the evening. So looking at helping to provide additional funds to our teachers to provide one-on-one tutoring when students are home, as well as continuing to utilize online one-on-one tutoring support that's called Brain Fuse, where we have approximately 2,000 students a month who participate in that one-on-one online support. And then lastly, from the data that we received from our online assessments, what we do know is that we've got to do a revision of our core content curriculum so we can focus on the content that was lost and spiral it into the curriculum that we must continue to offer our students at each grade level. Thank you, and I think I did meet my timeline.
Thank you, Dr. Golson. I hate to be an obsessive compulsive when it comes to time. Let's go to Dr. Griffith, followed by Dr. Bolson.
Sure. Thank you so much for having us on today, Chairman Penske and Madam Vice Chair Kagan and the committee and colleagues. It's great to see you as well. I will go rather quickly because some of it's repetitive and I don't want to be repetitive, but I am very proud of Talbot County Public Schools. We started in August and had all of our staff back in August, and our first week of school was all virtual. And the reason we did the first week of school virtual was so that all of our families would experience what virtual is, and they would be able to know what it means if we ever had to go back to virtual. And they could also make a well-informed decision about whether they wanted to continue the school year virtually or in person. And so very quickly, the second week of school, we started our small groups, and then we surveyed our parents to determine whether they wanted to be in person or virtual. And what we found was we had about 70% of our parents wanted to be in person and 30% wanted to be virtual. So we came up with a hybrid model, and we started that the first week of October. And we were hybrid the month of October, and up until Thanksgiving break, we actually had 3,000 students, which is about 70% of our students in each day, 700 employees. We did an AABB day model, and I can say that we were very successful, that we did not have one case transmitted in school during that time. However, right around Thanksgiving, our metrics doubled and then tripled. So therefore, we went back to virtual, continuing some small groups, but went back to virtual. What I can say right now is we have started up our small groups again this week. I was out in the schools yesterday. It was great seeing kids back in school. The staff was excited to have them. And what I can tell you is we started vaccinating our staff the first week of January. We started with our staff that would be working with small groups, our bus instructional assistants, our food service, our custodians, and any of our special education teachers. They're ready to get their second dose on, I believe it's next week. So they're on target. As of this week, we will have vaccinated 60% of our staff. And as of next week, 100% of the staff that want to be vaccinated will have the opportunity to be vaccinated. Dr. Salmon, you'd be very pleased that we've gone from 50% wanting the vaccine to 79%. So we're very excited about that because it was, I think, just getting people started and well-informed and educating. People needed to be educated. So when it's all said and done next week, we should have 79% of our staff vaccinated. And our goal is to start our hybrid model back up February 1st as we start second semester. I can also say that we were doing our extracurricular and sports when we were doing hybrid, and we did not have one case with 600 athletes in that was transmitted during school as well. So that's really quickly where we are. To take a look at mitigation of learning loss, and I do like Dr. Salmon's description of disrupted instruction because we don't want to blame the kids. But we really started the school year with social emotional learning, and we plan to continue doing social emotional instruction throughout the school year and through the summer. I can tell you we assessed all of our students when we got back to school. We waited and did it about the third or fourth week because we felt very strongly that we needed to address their social emotional needs the first couple of weeks of school. So we did not test the first week. We waited till about the end of September. And I really think that that's important because we learned a lot about our kids. And I think they needed to have that time with us to do this. This is all different for all of us. One thing I can tell you is we might want to talk about learning loss, but our kids are also persevering and learning a lot of new things too. They're learning how to do things more independently. They're learning how to be patient. They're learning how to take turns on a Zoom call, and they're learning how to be more attentive. So we all are learning through this as well. I do want to give a shout out to MSDE. They have provided a lot of professional development for our teachers of how to teach in virtual learning. And then our teachers have become teacher leaders in providing that professional development on asynchronous days, which has been really great. I believe truly this will be a paradigm shift for education. I think we will start seeing education delivered in different modalities in the future. I think we will look at extended school year, extended school days. We will look at providing summer learning opportunities for all children. I do think it should be intentional. I think it should be targeted, but I think that all children could benefit this summer. And last but not least, the ESSER money is going to be great, and it's really going to give us an opportunity to do more wraparound services. So thank you.
Thank you, Dr. Griffith. And I have to say your vaccination numbers and the people willing to get vaccinated are terrific. I think they give us a lot of hope and a lot of excitement. They're very, very impressive. Superintendent Polson. You need to unmute.
I promised myself I wouldn't do that, but inevitable. Thank you all for the invitation today. I'm going to try to fill in some gaps. I've crossed out a lot of my notes so that I can stick with the time. And so first on the topic of returning in person. In August, when the first round of metrics came out, when the COVID-19 guidance for Maryland schools was published on August 27th, that became the most important resource for our school system with its planning. Promptly after the publication of that, we produced our return to in-person plan. And by October, we had all of our staff back in our buildings and we began our hybrid. And we demonstrated that we could serve students at our schools in a safe manner if our metrics were in the place where they needed to be in the community. We worked to build the trust of our staff. We had great feedback about the in-person experience we had, and we were excited about the momentum. And then, of course, as everyone experienced, the metrics took a very bad turn beginning in November. We announced we would close on November 13th. And so we have been completely virtual since then. And a couple of things have emerged from that. Again, I believe the trust among our staff has been very good. They are not a barrier to us returning. I would argue right now that the barrier to us returning to schools is the metrics, is the rates of transmission in our community. Harford County stands ready to return to its hybrid when those metrics get back into a safe place. That's our current plan, and we expect to restart with our hybrid and our small groups that we had in place when we were in person in October. However, we are very much looking forward to any adjustment to the metrics. As Dr. Salmon indicated, there's a lot of work going on with those. Right now, the superintendents, we don't have much understanding of what's going to be the final outcome. But what my community understands is we've made a commitment to that guidance document, because the challenge we've all faced going through this is that if you stand in one place, advocating for more open or more closed, you will have no trouble finding science to support your position. There is research on all ends of this. And so we had to sort of choose a course, and we basically used the guidance document as our more authoritative resource. And so we're looking to the health department and MSDE to keep that updated as needed. And, there have been 2 updates to it since it came out August 27th. And when these next updates come out, my community and my staff know that we will be ready to make the adjustments and bring our students back in person as comply with that guidance. So that really has been what has steered our course, but we learned a great deal from our time in person. So let me just take a couple minutes, and I'm happy to answer more questions on that topic, but let me talk a little bit about what we will need to return to in person. So answering one of the upfront questions is the money coming in, the ESSER money, the stimulus and the support money. It's fantastic. I feel like not only from that money, but locally, my county executive provided funds with some reserve ESSER money that he had at the, leading up to the deadline. And I feel like our resources have been good. One of our challenges will be in identifying people, ready and willing to do the work all the way through the summer because people are tired. And so that's something we'll have to do a lot of work on between now and this summer. We have sustained tutoring to the degree which we have people available to do it. We certainly have the resources committed to it. So we've been doing tutoring throughout, and we have a team working on building on some of the work we did last summer with regard to helping students recover a little bit. But knowing that with the buildup we've had, we can target that much more to the students who need it. So let me talk kind of big picture about what I see coming for the school system. While we've all developed what we've called recovery plans, frankly, we're still in survival mode with this virus and this pandemic. I believe that as a school system, we are going to design a true recovery. We're going to block out time that's going to be our recovery time, because I think when we're beginning to turn that corner to go back to in-person learning, we need to take some separate time set aside to focus on mental health, orienting our students back into the schools, the relationships, those between adults and students to students, but working on relationships, but also equally important, looking at any gaps that may have occurred for students. And when we think about the gaps, we really are looking in two areas. One, with regard to maybe some habits that have gotten bad during virtual, because one of the things that happened this spring is we moved to sort of a pass-fail approach to our grades. And in some cases, students didn't respond to that very well, and some sort of checked out a little bit with that. Now with our first quarter grades, we see kids seeing the reality of what the grades are. And we're, since those first quarter grades have come out, we've definitely seen some behaviors change. But we have to work on those academic habits. And so leading up to our recovery time, we'll be focusing on those habits. But we'll also be focusing on some of the curricular gaps, the content gaps that may have emerged. I think we did something in Harford County that was really valuable at the beginning of this process, which is we took a very close look at our curriculum. We were struggling with how to do the, everyone back in the spring with the packets and the asynchronous and the virtual. And so we went in and we took our entire curriculum and focused on the critical content and really trimmed down. And we got down to the most important things that our students need to focus on every week. So we could trim down, because, it's often been said that curriculum is a little too wide and a little too thin in terms of, it's a mile wide and an inch thick. We've talked about how we can limit the number of standards and take that and then be able to take those deeper.
Great.
That's helped us.
Dr.
Okay.
Paulson, you want us to wrap it up?
Absolutely. And so again, I can answer specific questions about some of the recovery activities, but I think we have, a lot of strategies in place to help us to bring our students back to where they need to be.
Thank you. And the other reason I'm trying to be fairly tight, we have a 3 o'clock hearing of 10 other bills, so we want to conclude before then. Let's start with Madam Vice Chairman, first question.
Thank you, Mr. Chairman. Thank you, Dr. Salmon and Dr. Santelises, Goldson, Griffith, and Bolson for sharing your insights today. My question is what was not talked about today, which is broadband. It is an issue that the legislature will be discussing today. We all know that it's an issue in rural areas, in impoverished areas, and frankly, in households where a spouse or guardian or multiple spouses, guardians, residents, or siblings are all using the same Wi-Fi, and it's just slow and unreliable and stuff. So until such time as we return to schools, and hoping that that's soon and safe, and I know that that's our focus, can you please talk about anything that you've done or thoughts upcoming as to how to address broadband, or any wisdom or insight you can give us as we address this issue during this legislative session?
Dr. Griffith, you want to take the first cut at that?
Sure. First of all, thank you for the question, because that's an excellent question. And I do believe that is something we need to continue to work on. Talbot County Public Schools is very fortunate to have a one-to-one initiative. So we did have the technology, but the technology is only as good as broadband that can work it. So we actually put our education foundation mobilized them and worked with local Eastern Utilities, Delmarva, Atlantic, everybody. And what we did was we did hotspots and we had everyone covered, and it's all paid for. So that is a Band-Aid though. That is not a solution. We definitely need more broadband access. I know that, there's legislation about getting more broadband, and I've talked to Senator Van Hollen about that. The problem on the Eastern Shore is there's a lot of infrastructure that needs to be put into place, and it would probably be 6 to 7 years before it actually happens. But it is a problem on the shore in rural districts, but it's also a problem for Sonia Santelisa's in the city. So there's 2 reasons why you don't have broadband, and one is they can't afford it, and 2 is it's not even available or you don't even have access. So what we're finding is we're trying to make do, and we've done very well this school year. I am concerned in the future. Good question.
Senator Patterson. Dr. Salmon, I'll come back to you. Please unmute Senator Patterson.
Let me see down here, Doc. Okay.
You're on.
I should be on. Okay, great. Okay. Thank you again, Mr. Chairman, and thank all the wonderful county superintendents and our state superintendent for the wonderful work that all of you are doing across the county to improve the quality of student curriculum and skills and development. That's so critical and important. I got so many questions, Dr. Golson, so I know we're very limited to time. I listed about 7, but in lieu of asking all the questions, I wonder if you can just give me a contact person. Maybe you can text me that I could spend some time. I need at least a good 30 minutes. And I'll tell you the area I'm primarily going to focus on the summer program. How is that going to operate? What is the process, the procedure, transportation, lunch for the tutors versus teachers? I just need to know more about that because I think it's very critical. We got to provide some makeup time for students who are falling behind. Many of them are already behind, so you can imagine where they are today. So I hope we're going to spend some more time critically thinking about how we're going to implement those type of programs across the board. I would even suggest that maybe in Florida, I was down there, we had a program we used to call the best day of the week. The best day of the week was Saturday morning from 9 to 1, and students would come. But I just think, we got a lot of rural area. How will these students get there? And, will they get lunch and all those kind of things? I'm sure you got all that someplace, and probably all I need to do is pick it up and read it. But I would like to have a dialogue with someone on your staff.
Okay.
I'll reach out. I can reach out to Senator Patterson after this so we can schedule a time.
Good. Thank you. I appreciate that, Senator Patterson. I've got Senator Washington, Senator Ellis, Senator Fry Hester, and myself, and I want to get back to the state superintendent as well. Let's go to Senator Washington. Dr. Simon, maybe there are a few of these you can respond to near the end if you don't mind. Senator Washington.
Thank you. And also thank the 4 doctors being our leaders of our educational systems across our state. I was really happy to hear most of you talk about not just the academic gaps, but also some non-academic laps, particularly around behavioral, mental, and social emotional health. So I just want to lift that up. And when we're thinking about it, wondering specifically, do you feel that you have the funding or the resources or the staffing to really address some of these sort of non-academic components that many of you so rightly raised?
I'll go first. I do appreciate the funding we received in the down payment for the Kerwin legislation. That was instrumental in helping us to get mental health services to right now. What we have is in 96 of our schools. And had we not had that money, I can't imagine where we would be right now. Is it enough? Definitely not. I have 206 schools, so I only have half of those services and supports. But we were during the pandemic able to at least spread that out because we were able to use virtual experiences where parents and students could meet with professional counselors during that time to provide that assistance. So continue to advocate. I'm continually working to advocate for additional funds through Kerwin legislation. That was very helpful in during this pandemic and helping to fulfill that gap.
And have you done a kind of, and this could be anyone, have you done a sort of preliminary analysis of the governor's budget impacts or what you're hearing and how that might impact some of these programs, the tutorial programs, or some of what you're doing to address COVID?
he just got his budget today, about an hour before this meeting, and I haven't had a chance to, I just read the.
So we
budget
look forward to.
Yeah, we just got it today and I have a meeting this afternoon.
I guess I just wanted to put it out there that I know that we'd be very much interested in hearing about that, and maybe in particular, how you might be able to utilize some of your existing staff that may have been laid off to provide some tutorials. I know some of it is interesting, contracting out to other entities, but how might you employ some of your staff that you know, maybe they were working in the cafeteria, or maybe they were doing some of your custodial work, and maybe they're not able to do that anymore. How can we employ them to be part of both the behavioral health interventions and also your tutorial interventions? So that's
Okay,
sort of
so
a
when you
wish
get-
and a follow-up. So thank you.
Okay, thank you. Just please follow up on those particular questions. Let's go to Senator Ellis, followed by Senator Hester, followed by Senator Carozza.
Yeah, thank you, Mr. Chairman, and thank you to all the superintendents and your testimony. I just want to follow up on the question that I had for Dr. Simon, and Senator Patterson alluded to it, but instead of 6 questions, I just have one. I mean, Dr. Griffith came closest to what I think our students need, as far as not just the maybe special needs students or ESL students, but English second language students, but you know, our talented students who really didn't have the opportunity to do lab work or to interact with their professor, their teacher in algebra or in calculus, and you know, they're on their own basically for such a long time. I'm concerned about those students being left behind when it comes to not just getting into good schools, colleges, but being competitive knowledge-wise. And I mean, why not have a plan to have these students come in also, instead of getting a vacation in the summer from a vacation? Dr. Simon mentioned that there are enough funds to provide these extended education. So why, I'm not sure. Is there a contingency to bring these other students in when you look at the budget? Could any of the other superintendents answer that? For instance, Dr. Colson or?
Yeah, sure, I can answer. Actually, during the, I'm sorry, son, you want to go? Okay. During the summer, we actually did provide virtual summer school for not just our struggling learners, but even for our students who wanted accelerated learning. And we're grateful that we had over 1,000 high school students who took courses to accelerate their learning. So while we might not have highlighted that during this presentation, we did offer a variety of strategies and supports to students, not just our average students, but for our talented and gifted. And I had the largest number of early graduation students than I've had in years. So definitely, I know even for my colleagues, we all talked about that prior to the summer and made sure that we still offer things for them as well. So I'm sure my colleagues will co-sign that we all did something very similar.
Thank you.
Dr. Santelises, you want to add to that, or should we go on to the next question?
No, I would just add very similar to what Superintendent CEO Goldson said, and I will just note that Baltimore City had a record number of young people taking advanced placement tests this year, and we did that through distance learning. Our Wednesdays in the virtual space were dedicated to that kind of guidance counseling you're talking about. So very similar to what CEO Goldson said.
Okay, we're going to go on. I'm sorry, Superintendent Bolson. We're going to go on to Senator Fry Hester, please. Please unmute.
Thank you very much, Mr. Chair. My question is about going back to the $150 million and whether that's enough. I'm curious if that, when the superintendents were talking about just having seen that money, I guess I'd be interested in a follow-up conversation around whether that's enough money to cover kind of the learning loss that we're talking about, and in particular, the possibility of summer school, or whether it's also, fills the need that we talked about at the last hearing related to the expenses of having the buildings actually be safe for COVID-19. I'd really like for the school buildings that require that upgrade to the HVAC systems that we talked about to be able to do that in order to bring the kids back as quickly as possible. So I don't know if anybody has had time to think about even a ballpark number of whether the money that's being provided is enough to cover both the learning loss and the building upgrades.
I can tell you, I've already done an analysis of how much it would cost for one day of extended school year. So one day for Prince George's County is equivalent to $5.67 million. One day of instruction. So yeah. So multiply that and you have an idea of what we're looking at.
And I would just add that on the physical buildings, for example, we knew in the summer that the cost, what we got, we were thankful for, 77 million, but there was an additional 40 to $50 million gap when you're talking about the oldest buildings in the state. We purchased to date 8,000 air purifiers to be able to, take the place of those buildings, frankly, that are too old for the MERV 13, which is the high grade filter that's recommended for school buildings. So I do think, there is going to be kind of a day of reckoning between, investments in actual new school learning spaces and the needs that the pandemic has predicted. So we're actually tracking that very closely, and there is a gap.
Thank you.
Okay, let's go to Senator Carrozza. Please.
Thank you, Mr. Chair. First of all, I want to thank the state superintendent and all the superintendents for your leadership during a very difficult time. I want to echo the comment of our Vice Chair Kagan on broadband. Not only is this an issue, as we know, for education, but in every aspect, telehealth, telework, economic development. So I think we're finding out with COVID-19 that this has raised the need for access to broadband as a priority across the board. And I would just maybe more to direct this to the state superintendent and the individual superintendents as a comment that kind of trying to figure out where the needs are in each of the individual counties will help us with the prioritization, knowing there are limited funds across the board. With that said, my question is does not impact the budget, and I'm going to direct this to Dr. Griffith, but I would, if anybody else has comments, given the shift from in-person to virtual learning during COVID-19, and with increased involvement of many parents and guardians involved in their students, in their children's education, my question is, what processes or adjustments have you made during COVID-19 to assure meaningful parental involvement and feedback and to respond to parental questions and concerns, especially if their curriculum's been changed or narrowed as was testified earlier? Just wanted to know again, if there were some processes, adjustments that were helpful to address those parental concerns and to really make sure it was meaningful parental involvement and response to those concerns. So Dr. Griffith from the Eastern Shore, I'll hand that one off to you.
So thank you so much, Senator Carrozza. And actually what we have found during this time is our parental involvement has been as high as it's ever been. And we do find the time where our teachers are talking with parents. A lot of times parents are on the Zoom calls with the kids. And when we did the hybrid model, we made sure that we made time for parents on those asynchronous days, Wednesdays, to have those parent conferences. We are finding more parents are in attendance for their IEP meetings, for the multi-tier meetings for student services. So, the virtual environment has allowed more parents to be able to be involved with this as opposed to coming into the school. We have also surveyed our parents to figure out whether they wanted to change the environment that their child is in throughout the school year. And I think that's also important, that parents have a choice and then parents' choice is also being heard. We have streamlined our curriculum to make sure the core standards are being taught, and we've been sending out communication to our parents. And I think the parents do appreciate knowing what those expectations are up front. So I do believe that we have probably been communicating more than ever, and it has been well received.
Dr. Griffith, I thank you for that.
Thank you.
One quick follow-up.
They
do have questions.
Senator Carrozza.
Okay.
Senator Carrozza, we're gonna have to move on. Thank you. Final question. I looked at the $150 million, Dr. Salmon, that you mentioned for trying to relieve the learning loss. I think I divided it by 909,000 students, and that comes about $160 per student. Now, I know it probably won't be distributed equally to every jurisdiction, but I used my own county of Prince George's as an example. $160 per student times 125,000 students, give or take some. That comes to $20 million. So my question to all of you, and then obviously to you, State Superintendent Salmon, if we want to have intense tutoring over the next 12 months, starting this summer and into the school year of one-on-one or one-on-three, and we want to double, triple, or quadruple the number of students who attend summer school, do we think that 150 million, or what your pro rata percentage will be, will cover that? And if so, how short do you think you will be to get, for us to achieve minimizing the student learning loss that we expect to take place? And why don't I start with any of the four local superintendents, and then Dr. Salmon will go to you on this question and any others, and then we'll have to wrap it up. Any of the local soups?
Yep, I'll start. Honestly, of course, I'm gonna say it's gonna be short, but I'd really have to calculate, just like I took the time to calculate how much it would cost us for a full day of extended school year. Based on the amount you have, we have approximately 134,000 students. So of course we need we got 10,000 more than what you calculated. And even at that rate, the amount of money that we spent in in-person learning, and as I stated before, I'm looking at approximately 30,000 students with just identified groups. That doesn't mean all. So I'd have to do a little bit more extensive calculation, but I could tell you even now, the 5.67 million we need for one day, if we're talking additional support in the summer, I came up with $387,000 for just 30 additional minutes in 30 days. So I'm going to need a lot more funds than what's been allotted by district.
Okay, and I still want to hear the answers from any others, but if you can do some calculations without breaking the bank of what is reasonable in terms of tutoring over the next 12 months and summer school and what the costs, I think our committee and the budget committee will appreciate that, because we're looking at solutions. Again, any of the other local superintendents want to jump in, please, and if not, we'll go to the state superintendent.
I think your key point, Senator Pinsky, is this is not just something for the summer. You're talking about long-term, and I think we all could get back to you with some numbers.
Okay, then let's shift to you, Dr. Salmon, and this will close this section, and then we'll go to hearing from Cheryl Boast from MSEA and Ms. Brown from BTU.
Thank you, Senator. Just to stay on the same question, I think we also have to realize that 150 million is on top of the normal increase that each school system got in the governor's budget. And additionally, they have the CARES, the ESSER 2's funds that they can use all the way through 2023. So I think we have to look at the compilation of those funds that are available and not just the 150 million.
Right, but let me just push back a little bit. The money in the budget is for normal operations. I mean, we're talking about dealing with the learning loss unique to the pandemic, and I'm not sure the existing foundation formula and all the other money to the jurisdiction is going to give that special impetus, almost like an educational Marshall Plan to recoup what we've lost these 12 months. And my understanding from listening to superintendent, some of the CARES money has been used to buy Chromebooks, to buy air filters, and a lot of other things as well.
Right, and I certainly agree with you on that, but there is the money that was just distributed is a significant. It's 4 times the amount of money that they received initially. It's a lot. And that's great. We need as much as we can get, and we hope that we're going to see another package come along. So I just put that out there. That's something we've been advocating for. In terms of the broadband, I just wanted to bring the committee up to date. We had $15 million was awarded from the GEARS money from the governor early on to the Office of Rural Broadband. And they've been working on a project to do broadband across the state. And right now we have a signed MOU, And they're anticipating that the network is going to be operational across the state by August of 2021. Additionally, there was $10 million that school systems could apply for to enhance their broadband. And many of the school systems, and even some of the ones on the call today, did receive money for that as well. I would be happy to provide you an update on that and send it over to the committee so you have that information. I have, it's a lot of information. I'm not going to read it right now.
Yeah, no, we thank you for your presence and your feedback, Dr. Salmon. We're going to shift to Cheryl Bose, President of MSEA, followed by Ms. Diamante Brown of BTU. I know Dr. Santelises and Dr. Griffith and others may have to go. We thank you for your time and your input, very valuable. You know, we're here to shape some policy to try to help the people of the state, particularly the young people of the state. So if you have other strategies besides the tutoring or the expanded summer school, please get back to us ASAP, because there will likely be legislation in the COVID relief package dealing with education. Thank you. Ms. Bost, let's unmute and please begin.
Thank you, Chair Pinsky, Vice Chair Kagan, and members of the committee. Thank you for having MSEA here. As you know, we represent, and we have a slide presentation. As you know, we represent over 75,000 educators across the state. The next slide, please. Not just teachers, but the whole gamut of educators. And they are and have been heroic throughout the pandemic in educating our students, feeding our students, transporting everything that goes along with that. I want to, I don't want to move slides yet, but before we do, I want to address your first question, which is about the reopening that we're currently in. I appreciate the local superintendent's comments, especially Dr. Bolson, we're still in survival. We're still in the middle of this. We appreciate that educators were prioritized for vaccines, but as you and Dr. Lamb especially realized, the messages have been mixed, the metrics have been changing, and this often creates a lot of distrust with our educators. And we have our fellow educators right now who are sick because of the COVID. I have one of our leaders who is currently in the hospital, an educator in the Eastern Shore. So it is very important that we get solid messages and that we're part of the collaboration. And I want to thank the local superintendents who have been collaborating with their associations. Currently, concurrent teaching, trying to teach students in person and online, like we're seeing in Carroll County, is totally burning out our educators. We need more staffing. We need someone in the classroom to help with those students who are virtual, while the teacher is teaching the students in front of them. And also the state dashboard showing cases is still woefully inadequate in actually being transparent about the number of cases. But like you, and you can change the slide, please, we need to look forward. And so we're looking at a vision for recovery, which will be student-centered, educator-led, community-based, and transformative. And so the next slide, please. We are looking at any type of diagnostic assessments. And assessments doesn't mean a test. These could be tools, teacher judgment, already existence diagnostic tests that some of the systems have talked about as a way to see which students have been impacted the greatest in their learning deficits before they enter into school next year. But coupled with that, and I was pleased to hear so many superintendents talk about the social emotional learning. I don't know about you, but when I go in a grocery store, I still stand with my arms next to me and I'm really close. Imagine our kids trying to go into a classroom. Imagine our teachers. We're going to have a lot of separation anxiety, even up to second, third grade. So all of these things have to be addressed. We have to figure out how to best address them. And we don't currently have enough social workers, counselors, and psychologists. And then the tutoring. We are encouraging everybody to use our education support professionals, use our aspiring educators, retirees, everybody to help with the tutoring. You can go to the next slide. Because of time, I'm only going to hit a few of the things on each one. Educator-led, the blueprint, the override of the governor's veto on the blueprint is critical when we talk about educator-led, into increased staffing, increasing teacher prep, increasing pay. We are facing a teacher shortage. And so the blueprint will help us to overcome this. and move forward in the coming years, and also some accountability for the provisions within the blueprint to make sure that the money is being spent where the legislature expected it to be spent. Next slide, please. We want it also to be community-based. Not only are students and parents dealing with this virtual learning, our entire school community. So community schools are key. Expansion of career technology will make us workforce ready, and dealing with the concentration of poverty grants will assist on those students who are most impacted. And we also, again, culturally responsive trauma and awareness. And as I go to the next slide, which is technically our last slide, one of the things that was missing in today's conversation is how we're going to transform our schools. Too many students, especially our Black and Brown students, were not properly being educated in our current school structure and system. And so we have to look at equity issues by expanding and diversifying our educator pipeline, by making sure all students have access to CTE and more rigorous coursework, and really have an equity focus as we recover from the pandemic. And that includes the broadband functionality. It also includes the facilities that you all talked about. So there's a lot in these slides, but we are ready to be partners. We are happy that so many of our local superintendents have been willing to partner with our local association, and we're looking forward as we move further into the coming year to collaborate at the state level. And we often will collaborate with you. And so the final slide shows you our team as we move into this legislative session that are always willing to work with you. Our new addition, our new government relations director is PK, and we're excited to have our team together. So thank you for the time, Chairman Pinsky.
Thank you, Ms. Bost. We're going to go to Ms. Diamante Brown, and then we'll take questions for both of the panelists. Then we'll have to wrap up before our 3 o'clock hearing. Ms. Brown, please.
Thank you, Senator Pinsky, for having me. The BTU perspective on in-person instruction is that staff need to, at the very least, have both doses of the vaccine and be given a 14-day wait period for the vaccine to take effect. Also, ventilation work must be completed and verified before any students or staff are brought back into buildings. At this point, only 28 of the 108 elementary middle schools, that's about 26%, have completed air ventilation system upgrades, according to a city school status report. And we have many other concerning data points here, but I'll move on. We also believe that at minimum, public health metrics must be met. The positivity rate below 5%. At the very least, we cannot be in CDC's category of highest risk of introduction and transmission of COVID-19 in schools. We also believe that simultaneous instruction hurts the quality of instruction. No students will receive undivided attention, and the district acknowledges that the vast majority of our students will remain virtual. Therefore, with most students remaining virtual, we should be spending more time focused on their needs and making that environment as strong as possible, which includes internet connectivity, schedules that make sense for families, and so on. As far as learning loss, we just want it noted that we're only speaking to learning loss that we suspect people identified as what happened throughout the pandemic, despite the fact that we teach students that come to 11th grade on a 3rd grade reading level. So I hope people don't forget that. However, we believe to mitigate learning loss, you need to provide holistic, high quality engagement experiences that emphasize relationships like the arts integrated, project-based young audiences of Maryland program, rather than boring, narrow test prep on reading and math that disengages hard to reach students in the first place. We also need greatly improved internet connectivity and stability for our students. Their rates are throttled. They can't stay on video. They can't meaningfully connect with their teachers. And also, when we talk about tutoring, we need to get away from adult tutoring, and we need to revive peer-to-peer tutoring program that acts as both a jobs program and an effective tool to connect hard-to-reach students with brilliant young people who can teach them in a different way. We can't answer your question about how many students need services and how is that being determined. That's a question our district has to answer for you. However, we do want to note that the district conducts assessments for special services and provides those services in compliance with federal and state law. And we have expressed our concerns to the district about the way in which the assessments are conducted and services are provided. As far as standard assessments, we believe standardized assessments should not be completed until they are safe to do so in person. Distance standardized testing results are invalid. If standardized assessments move the needle on equity, it would have already closed learning gaps over the past 20 years. It hasn't. However, it is a useful tool for educators and administrators, but not the right one at this moment in time. Anytime students spend in school buildings should be dedicated to restoring relationships with students and providing instruction. Time spent on WIDA and MCAT is lost time we could be having with our students. And lastly, as far as mitigation, once again, we believe high-paid, high-quality summer school is crucial to incentivize participation from both teachers and students. High-paid, high-quality after-school, small group tutoring with educators and trained paraprofessionals who have strong relationships with their students. And as mentioned earlier, peer-to-peer tutoring would further mitigate learning loss. Thank you.
Thank you, Ms. Brown. We have about 10 minutes for questions. We're going to start with Senator Gallion, followed by Senator Fry Hester.
Thank you, Mr. Chairman. A question for Ms. Boast. Back probably during the summer, a bunch of school districts were contemplating doing at least a hybrid or some type of in-person instruction. MSEA came out with their statement that opposed reopening pretty much altogether. So my question is, well, after that, then pretty much things shut down. So what metrics would need to be hit to get to a point where MSEA would give the okay to have the schools open back up?
Well, I wish I had the power to say all schools are closed or all schools are open, and we don't have that. It's been a collaboration between the local associations and the districts to not only look at the metrics, but look at what safeguards that they can put in place together with BTU and the PTA. We formed that joint letter saying that health and safety has to be the #1 priority. We've also put together a health and safety checklist that combined all the CDC regulations, Maryland Health Department regulations, everything for opening up schools. And the biggest part of that was the funding that has not come at the same time. As we know, the federal stimulus package was delayed, and now the state funding won't go in until the next budget to provide masks, the plexiglass that was needed to allow for the social distancing and the extra staffing. So if you go back to our letter, we said health and safety has to be the priority. When schools can meet what was not provided at that time with state guidance on metrics, that didn't come out until just about schools starting. And then you can start small groups. And that's what many of the systems have done if they can meet the metrics.
So if we had got up to where faculty, staff, teachers got up to 100% of vaccinations, or at least offered vaccinations, and say the metrics, the positivity rates were under 5%, would it be okay in your estimation to get students back in school then?
I would say as long as the health precautions that have been recommended by CDC and Maryland Health Department are still in place, because once educators are vaccinated, that doesn't mean the general population has as well. So we're still going to need the social distancing, the masks, and everything else. And if we can do that, yes, we would encourage schools to start in-person learning as we've seen across the state.
And one other question, I don't know if you can answer this, probably a previous panel would have done, but I wasn't able to get the question in time. We talk about the learning loss, which is a huge concern. What percentage of the students do you think could potentially are going to have to repeat the grade they're in because
So
of
as I
learning?
talk to educators, there's not an across the board whether students have to repeat or grade or all students have had loss like many of the superintendents shared. I would have to agree with Dr. Bolson. I think it's a way to diagnose each child, do a diagnostic of some sort. Some students have thrived in this environment because there hasn't been bullying or they want that isolation of learning. So it's one diagnostic of that. And then it's looking at the standards that are critical and making up those standards and taking some time to do that and not just saying, oh, when we go back into school, things start up right as they did. So it's going to be very individual, just as our education is on a daily basis.
Okay, thanks.
Thank you. Let's go to Senator Fry Hester.
Thank you. I just wanted to circle back to one topic that's come up a couple times, and that's the mental health of our students. And I wanted to acknowledge that there was a late amendment to HB 1300, starting about page 177, which is a huge boost for mental and behavioral health supports. And it requires MSDE to have behavioral health services coordinators in each district. And it establishes the community supports partnership, which allows connection between private providers and the school system. And then there's a grant fund attached to it. So my question is, has anybody either with MSDE or with the teachers unions or the superintendents, are you aware of that? And are you prepared to move forward should the HB 1300, the Blueprint for Maryland's Future, be overridden?
Are
So
you
I can tell you
prepared to use more money? Yes. I mean, I don't know what my district is prepared to do. I never know what my district is prepared to do. However, what I do know is that our students need more mental health professionals. And I would take it a step further that in Baltimore City specifically, our students need more Black mental health professionals. And yes, when money does come and when we do override, we'll be ready to advocate for the needs of our students.
And I would just add on to that, I ironically had a chance to talk to psychologists and school psychologists and counselors and everybody last night at a meeting. And part of the problem is we need all of that. It's also having the trained people. There's a pipeline issue that we're having and a retention issue of keeping psychologists that are working on a workload that's 3 times what the industry standards are set for them right now. And on private placements, many of our more rural systems, students have to wait for months to see someone for mental health services outside of the school. So we need that funding, we need that program, and then we're gonna need the help from the State Department and our higher education partners to build that pipeline so that the service providers are actually there for our students.
Senator Hester, just to add on, because I agree, it's really the pipeline. We haven't had enough mental health services for years. This is not a new problem. This is ongoing since I was an educator way back here in Talbot County. And we just don't have the supply. I mean, we certainly want to provide many more services, and we're going to need to provide many more because adults are traumatized from the pandemic. We can only imagine how children are managing right now. So I think we need to look at finding a stimulus program to get more students to go into the field and nurture them, pay for their tuition, and then they have to come back and work in a school system like we do with some of our teacher programs to incentivize that. So we're going to be really needing the people to do these services.
Okay, Senator Washington, next to last question. Please unmute.
Great, thank you. And this is directed, well, first, I just want to thank Ms. Bose and Ms. Brown for lifting up our teachers and thinking about their burnout and what they're doing. I think also this is, again, directed to Dr. Salmon, sorry. Both of these educators have mentioned about that there's been mixed messages and sort of mixed metrics, and I think Dr. Lamb also sort of highlighted that as well. They've made a number of very specific requests around solid messaging, around looking at burning out of educators, looking at when you're thinking about metrics, the proportion of of teachers and staff that have received the vaccine, that there needs to be ventilation. Of what you've heard today, are these, and you said you all have been putting together metrics, are any of these part of your new constellations of recommendations for procedures, surpassing just guidelines, but setting up real standards for reopening?
Well, I would just have to say, Senator Washington, although I appreciate your question, we have provided guidance. I think part of it is that the guidance is so robust that sometimes people don't take the time to read the guidance and to look at everything. I mean, we have posted very, very specific kinds of issues and also about ventilation as well. So I would encourage people to review the guidance and to look forward to any updates to that guidance as we find more research to support in-person learning.
Well, just so that I can understand, so are you saying that if a school district is not meeting the guidance, 5% positivity rate, ventilation, that they should not open?
I'm not saying that at all. I said that there is guidance out there to make decisions. There has been guidance, and it is sometimes people look at the wealth of it and don't particularly get into it. So I would have to say that the guidance is there, and it's a matter of how it's interpreted and how the local systems with their health departments, their county governments have interpreted the community spread in their different communities. There's a lot of moving parts to this. It's not an easy on and off.
Thank you. Final question, and first of all, I want to echo what's been said about the heroic work of teachers and their teacher organizations, MSEA and BTU, for the work they've done. Teachers have been heroic, and I would say parents and students have also stepped up during this very difficult time. My final question is this. We've talked about targeting students for tutoring for summer school, and it could be in the thousands, multiple thousands. I think Dr. Golson said it could be 30,000, I think I heard her say, or I could be wrong. I guess my question is this to you two: how do we decide who to target? And I know we don't want to use assessments, statewide standardized assessments if we don't have to. But in terms of targeting students only, for formative purposes, not for evaluation, not for anything else. And there's been some questions leaving up to individual teachers because individual teachers have different standards and it's not always the apples to apples. So I guess my question is two things. One, how do we target students who need the one-on-one tutoring? And again, which could be a very large number. And if we have to use, would you object to a statewide assessment if in fact it's simply used for formative purposes?
I'll start with that. And I just want to add, Senator Pinsky, and I know you would agree with me, it's not just teachers that have gone above, it's all of our education employees who are doing
Absolutely.
a heroic job in our schools. So I think we can find a combination of many of those things. So no, a statewide assessment is not going to meet that goal. But I think we can use, many of our systems are already doing online benchmarking type items. Some people have used a form of map testing. So some of that can be used, but put that in combination with absenteeism and put that into combination with what teachers who are with the students every day put together. So you're not using one item, you're using a marriage of 2 or 3 items to say, student X is behind. I think the parents should also be questioned on that because they've been the direct teacher for many of these students or co-teacher. So there could be multiple measures that are done starting now to help us identify. And then what one of the superintendents brought up is finding enough educators to then work in the summer. That's why I think the plans need to start now so that we can then identify that we have enough staffing to meet those needs of the students and look at their social emotional diagnostics as well. But I'll let Diamante also.
I would just add that in Baltimore City specifically, I would, and maybe in other districts, but I'm not as well versed in those other districts. I would prioritize students that pre-pandemic have been several grade levels behind. And no, an assessment would not work because those students don't take assessments. They don't even come to school. and they don't have to come to school because we allow them to remain on our roll so that we can continue to get money for enrollment. And they're on our roll for at least 1 to 2 quarters without stepping in the door. And then we give them no less than a 50% on their grade. So it's not much that they have to get to. So the students that we want to get to, that student that I said you give me coming to the 11th grade to still reading on the 3rd grade level because of No Child Left Behind and all the other policies that allowed them to pass on and on and on. Like I said earlier, the way you get to that student is offering summer programming as dual employment. And if you put it out there that you're paying them to come to summer school, I promise you the right students, at least in Baltimore City, they'll come. Because those are the ones that are checked out because they've had to decide between, as we keep talking about, poverty and figuring out how to eat and figuring out how to accommodate what we want in this structure of education, we call it.
Great. Thank you. Thank you both, Ms. Brown, Ms. Bost. That concludes the hearing. We want to thank all of you, and please offer feedback as soon as possible on some of the unanswered questions. We are looking for any additional ideas and support going forward. We have a hearing at 3, and Ms. Stanton, if you would get on at 3 and tell people we'll start at 3:05, that'll allow a 10-minute personal break for the committee to stretch and take business.
Will do.
This concludes the hearing on the briefing on education, and we'll start our bill hearing at 3:05. Thank you.